Exercise is also very stress relieving, and so by exercising regularly, you're able to set a kind of normal rhythm as far as your hormones, as far as being tired at night and sleeping well, and having a healthy appetite. So the adrenal glands are an organ in your body that I think is often underappreciated. And what the adrenal glands help control is, number one, they produce something called cortisol. They're involved in the production of testosterone and estrogen. They're also involved in regulation of vitamins and minerals in your body, and they're involved in producing adrenaline. So the adrenal glands are often under a lot of stress when we're not treating our body very well, and they're a very important organ for us to keep our eye on and to test to make sure that you're not suffering from overactivity of the adrenal gland or underactivity, both of which we will talk about soon. How do we identify adrenal dysfunction, and what are some of the things that cause adrenal dysfunction? Well, first of all, the way that we identify adrenal dysfunction is the way that we identify any other functional medicine disruptions, which is with data-tested, scientific-backed testing. So in my clinic, often we'll do a saliva-based adrenal function test, and this will include collecting cortisol, measuring cortisol at different times of day, as well as collecting DHEA. Cortisol and DHEA are going to give us a really good idea of how your adrenal gland is functioning and if there's something that we need to do to treat it. Now, what are some of the things that can cause disruption of the adrenal gland? Well, number one would be excessive stress. Every time our body is under stress, this could be mental stress, emotional stress, physical stress. That's going to tax the adrenal gland. Poor sleep, so not sleeping well when we sleep, that really helps regulate our hormonal cycle, our neurological cycle, and make sure that everything in our body is in sync. If we don't sleep well, we're not going to produce cortisol at appropriate intervals. It's going to affect our androgenic hormones. We're going to get adrenaline spikes and things like that. So we need to have good sleep. Good nutrition, right? A lot of the vitamins and minerals that we get from foods are going to help these organs do their job, right? And the adrenal gland is no exception. The adrenal gland requires minerals in order for it to do what it does and produce these neurotransmitters, and so we need to make sure that our diet is clean as well. And regular exercise can also help with adrenal gland function, both directly and indirectly. When you exercise, you increase your metabolism, you promote an environment of healthy neurotransmitters and healthy hormones. Exercise is also very stress relieving, and so by exercising regularly, you're able to set a kind of normal rhythm as far as your hormones, as far as being tired at night and sleeping well, and having a healthy appetite. So one of the common things that I see with the adrenal gland is overactivity of the adrenal gland. So if we have a chronic stress response that is not attenuated, we'll see an excessive production of cortisol typically. And some of the symptoms that people will have is they'll feel anxiety and depression, they may feel fatigue, they may have immunosuppression, meaning that they're going to be very prone to illness. So when you're thinking about somebody that has hyperactivity of the adrenal gland, you want to think about somebody who is tired, who's feeling lethargic, who's unmotivated, who gets sick often. You may even see dysregulation of cardiovascular markers, so heart rate might be off, you might have issues with cholesterol management, things like that. You may be at risk for becoming overweight, not having good weight regulation. The other type of adrenal dysfunction that I see even more commonly than hyperactivity is hypoactivity. So when the adrenal gland is constantly under siege by stress, and it's producing a lot of stress hormones and producing a lot of cortisol, eventually you end up with adrenal burnout, right? And this is a term that's used a lot. Particularly, I remember back when I was training CrossFit, a lot of people were having adrenal burnout because they were overtraining, too much adrenaline. Eventually your adrenal gland shuts down, right? And number one, this is going to affect your hormones, your male and female sex hormones. So if you're a woman, you could end up with dysmenorrhea. If you're a man, you could end up with erectile dysfunction. You could see mood changes in both men and women because those hormones affect mood. The other thing that you're going to see most often is chronic pain, right? These patients tend to have chronic joint pain, fibromyalgia, pain with exercise. Maybe you have a back injury that is taking forever to heal. So these patients have a hard time healing from injury and a very hard time recovering because their adrenal gland is not working properly, and that's affecting other hormones in their body and significantly affecting their recovery. You're also going to see things like brain fog and memory loss and difficulty concentrating as well. So, if you're experiencing any of the symptoms that I listed for either hyper or hypoadrenal dysfunction, go ahead and come on in. I'd love to do a consultation with you, and we'll make sure that we get you tested so that we can figure out exactly what's going on, and then we can treat you.